Hi everyone. So we are learning about conjunctivitis. So conjunctivitis means we know it is the inflammation of conjunctiva. So there will be conjunctival, hyperemia and discharge. Discharge can be white, watery, mucoid, mucopurulent or purulent. So depending upon the cause, discharge will be different. If it is bacterial, it will be mostly purulent, mucopurulent discharge. Watery discharge in viral cause, and stringy or ropey discharge in allergic conjunctivitis. Types of conjunctivitis: infective, allergic, cicatricial, toxic. So infective, it can be bacteria, virus, a lot of causes can cause the infection. So first we will learn about bacterial conjunctivitis. A bacterial, it can be acute, hyperacute, chronic, angular, and particularly we say about this chlamydia, which is causing trachoma. So it can cause neonatal chlamydial conjunctivitis, adult inclusion conjunctivitis. Another causes from virus, and the virus mostly causing is adenovirus. Adenovirus causing involve both cornea and conjunctiva, that is epidemic keratoconjunctivitis or pharyngoconjunctival fever. Then another is enterovirus, molluscum contagiosum, herpes simplex. Then ophthalmia neonatorum by gonococcus and granulomatous conjunctivitis. So this is actually we are learning about this broad classification, okay. Allergic conjunctivitis can be simple allergic conjunctivitis, vernal keratoconjunctivitis, contact dermoconjunctivitis. Simple can be seasonal, perennial, hay fever. Vernal keratoconjunctivitis VKC, it can be flectenular, atopic, giant papillary. See, these are actually different. Simple allergic conjunctivitis can be seasonal, perennial. Now, second is vernal keratoconjunctivitis VKC. Another can be flectenular, another can be giant papillary, another one is atopic keratoconjunctivitis, and one is contact dermoconjunctivitis. Cicatricial conjunctivitis is seen in like Steven Johnson syndrome, toxic epidermal necrolysis. Another one is toxic conjunctivitis. So here we have got different types of conjunctivitis, like from the infective, then allergic, cicatricial, toxic. Infective itself we have a lot to learn. We will start with bacterial conjunctivitis. We told it can be acute, can be hyperacute, can be chronic, chlamydial. Acute means as we told, same repeating, hyperemia, mucopurulent discharge. It is called acute mucopurulent conjunctivitis and the organism is Staph aureus. And symptoms and signs. Symptoms will be, patient will be complaining of, so there will be discharge. Discharge is causing stickiness of the lid margins, photophobia, colored halos, blurring of vision, foreign body sensation. And the signs, when we look, we can say chemosis, congestion. Congestion is conjunctival congestion. Then there will be matted lashes, cilia will be matted, there will be yellow crust, eyelids will be having edema, flakes of pus, mucopus will be there, papilla can be there, petechial hemorrhage can be there. Can see flakes of pus and matted lashes here in this picture. Okay. So it can cause, what it can lead to infections, blepharitis, dacryocystitis, keratitis, corneal ulceration, superficial punctate epitheliopathy, means superficial punctate epithelial keratitis, Treatment. Treatment is topical antibiotics. An example for a topical antibiotic, anything, Ciplox eye drops, or fluoxacin eye drops. Photophobia, so you advise dark goggles. You do not give bandage and steroids because again that will proliferate. You can give analgesics and anti-inflammatory. So this can spread to others, so you be very careful. You have to wash your hand every time, otherwise you will contaminate with the things which you are using, and somebody will, when you share it with someone, when you are using a handkerchief or a towel, and if it is used by other person, they will also get the disease. Hyperacute is acute purulent conjunctivitis. Okay, two forms: acute purulent and ophthalmia neonatorum in newborn. So it is gonococci causing adult males. It is transmitted from genitals to eye. Symptoms are almost same: purulent discharge, pain, photophobia, sticking of the lid margin, blurring of vision, swelling of lids. Signs again: swelling of lids, chemosis, congestion, papillae, discharge, tenderness, preauricular lymph nodes. So this peculiarity is gonococci is mostly causing urethritis, arthritis, like that. So from genitals, maybe your hands are contaminated and you're putting it into eyes so that your eyes gets infection, like that. So the complication is again, it can cause corneal involvement, corneal ulceration, perforation, and it can cause iridocyclitis. Okay, this is the picture. Treatment is same: antibiotics, atropine, irrigation. Treat your partner because it's genital to eyes. Chronic bacterial conjunctivitis. So chronic, it's a chronic. You're exposing towards the smoke, dust, and the chemicals. So the predisposing factors: you are always exposed to the dust and the smoke, or always you have some irritation on your lids, some trichiasis, congregations, foreign body, you're giving strain to the eyes, you're having alcohol abuse or some metabolic disorders. So such people are more easily affected with this chronic conjunctivitis. Causative organism is Staph aureus. How the infection is: maybe it is a continuation of mucopurulent or from the nearby infection like dacryocystitis, rhinitis, or it can be from direct contact, airborne, or material transfer of infection. Patient will say, I'm having redness, dryness of eyes, grittiness, burning and grittiness, and there is mild mucoid discharge, watering, tiredness of the eyes, all this. When you look signs, there will be papillary hypertrophy. Conjunctiva will have a sticky look of surface. Lid margins are congested. So you give some eye drops, some lubricants, some antibiotics, because patient is having some dryness, some grittiness, burning, isn't it? So it's not like others. Other acute and hyperacute is they have a lot of symptoms: pain, redness, photophobia, lacrimation. Here, such things are not. It's like a discomfort in the eye. Next is angular bacterial conjunctivitis caused by Moraxella. Okay. So Moraxella is, it's like it's confined to the conjunctiva and the lid margin near to the angles because of contaminated fingers or handkerchief. So Moraxella is actually releasing a proteolytic enzyme. So the epithelium in that region was macerated. This enzyme is collected at the angle by the action of tears. So, and it will macerate the epithelium in the conjunctiva, in the lid margin, the skin. Okay. So there will be a response, vascular and cellular response from our body, and there is inflammation. So skin may show edematous changes. So what you can see, patient what will be complaining, at the angle of the eyes I am having redness, and there is feeling of discomfort, irritation, burning sensation, and some discharge is there at the angles. Patient will be saying like that. When you look, you can see near to the angles there is hyperemia, there is mucopurulent discharge, there is excoriation of skin. All this you can see near to the angles. Okay. So it can cause marginal corneal ulceration, it can cause blepharitis. So treatment is zinc, ointment, and antibiotics. Chlamydial conjunctivitis. So it is keratoconjunctivitis affecting both conjunctiva and cornea caused by Chlamydia trachomatis. It is producing intracytoplasmic inclusion bodies, HP bodies. Affected is females in dry and dusty weather or dust, smoke, sunlight. And the source of infection is from the infections or secretions from the affected person. It can be either directly spread via the air or water, or it can be by some material like towel, handkerchief, or it can be by a vector like flies. Phase of active trachoma in the childhood. So it is symptom can be like mucoid discharge, stickiness of lids, occasional lacrimation. What you can see in the conjunctiva, what are the signs in the cornea is important. So we are discussing about the first phase, that is active trachoma, active stage. What you can see in the conjunctiva, a lot of papillae. What is this papillae? It's reddish. It is some flat top raised areas giving red velvety appearance. And you can see some follicles, that is boiled, sago grain appearance, and there is congestion in the upper tarsal and fornical conjunctiva. Now what you can see in this cornea, you can see some pannus, see some vasculature infiltrating the cornea, that is progressive pannus. You can see some follicles in the cornea, Herbert follicles, and there will be keratitis, corneal ulcer. Next phase of cicatricial trachoma. What you can see in the conjunctiva here, follicles are not that much visible. You can see some line where there is, that is a line of cicatrization. Okay, that's called Al's line. And there can be congregation, pseudocyst, symblepharon. In the cornea, what you can see, pannus have less vascularized, that is regressive pannus. Herbert follicles have gone. Now you have seen only pit, Herbert pits. And cornea, what happened? There is cirrhosis, dryness. There is opacification, cirrhosis, ectasia. What you can see in the lids? Lids may be hardening, that is thickening of the lid margin is called tylosis. Loss of some eyelashes, madarosis. Or there is some entropy or inversion of the inward rolling of the lid margin, and inward rolling of the inward direction of the lashes is trichiasis, and lacrimal apparatus can get inflamed, acrocystitis. So we told about active stage and cicatricial stage. So what are the staging? Trachomatis inflammation can be follicular, it can be intense, it can be scarring. So the staging is actually WHO given, that is NTF, TI, TS, TT, CO. Just read trachomatis inflammation follicular. So follicular means you can see 5 or more follicles, means that much amount of follicle should be there. And through the follicle you should see some vessels. Then intense means the conjunctiva, tarsal conjunctiva is thickened, obscures more than half of the normal deep tarsal vessels, that much thickened. You cannot see the vessels because of the thickening of this conjunctiva. Scarring means you will see the scars. So in this picture you can see a lot of follicles. Next picture, it is very thickened conjunctiva. It's in indent stage. Here you can see the white scars. So it is scarring. Here you can see the trichiasis. So we know it is a complication. How to manage is safe strategy given by WHO. So if there is trichiasis, we told a lot of complications can occur. So for that, you can give surgery, do a surgery. Antibiotics is mainly azithromycin, 1 gram azithromycin. You have to facial hygiene is important and environmental hygiene is important. Then antibiotics, okay. So that is the, you can see azithromycin is given 1 gram. So a medication that's a oral medication given. Topical medication again azithromycin 1% eye drops, tetracycline again 1% eye ointment.